Today's talk is about implementing best practices of professionalism in your daily routine. So all of us now talk about professionalism and we seem to know about professionalism. But I thought, no, we'll just touch upon this topic because there is so many views about it, and we'll see if there's any practical way in which we can implement this in our daily routine. Okay, so in this talk, I'm going to talk about what is professionalism and how do we implement it, and try to finish it in 25 minutes so that we can also have some time for question and answer session. So all of us have read about professionalism. We keep telling that it is commitment to our profession, dedication to our profession, and it's a lifelong journey. Somehow, no, professionalism seems like marriage to me. We talk of the same terms when you talk about a marriage, commitment, dedication, it's a lifelong journey. So, and we also have this phrase where you say he is wedded to his profession. So definitely, the wedding and your profession seems to have all these common things here. So the commitment is to know either the values you have, the ethics you follow, and the standards of each profession. Now, you may be a doctor or nurse or a lab tech or a OT tech. So whatever standard that particular profession holds, you should be committed to it. There should be dedication to your integrity, dedication to have excellence in what you practice, and accountability, very important. And it's a lifelong journey where you always put the patient first. You keep on learning. So most of you who joined here are now having this aspect of professionalism where you want to keep learning a little bit more. So that is the lifelong learning journey we have. And also we should be open to adaptability and change. So I'm sure all of you would have read this or heard somewhere about it, about professionalism. But what I wanted to point out is professionalism is also a view of things. Like this famous story of the 6 blind men and the elephant. So each of the blind person looked at one part of the elephant and said, no, one who held the trunk was very sharp and he said it's a spear. One who looked at the body said it's a wall, and so on. One who's touched the tail of the elephant thought it was a rope. So it is a perspective, and it all depends on how we look at professionalism. So the same thing can be said. No, each of the persons or the experts keep telling one thing. So it's commitment, it's competence, it's ethics. But what is professionalism in toto, and how do we actually practice it? This is a very important aspect, and that's what I want to touch upon in this talk. So you know that this talk was called best practices, but actually I want to point out that this what we are going to talk about from now on is going to be a multi-dimensional approach to professionalism, where you integrate every element of yourself. So we have different aspects of yourself: physical, mental, social, intellectual, and spiritual self. So because professionalism, we need to give ourselves to the profession. How do we look at professionalism and each of these aspects, and what are the things we can do in each and every one of these elements to make ourselves professional? So this is what I'm going to touch upon today. So there is the social element, then there is this intellectual element, and an emotional aspect of our professionalism, and finally spiritual aspect. Now the word spirituality is now become a bad word, isn't it? So am I talking about religion or spirituality? People get confused. So I wanted to avoid that term and say what are our core values. Now we will probably mention this word spiritual maybe in 1 or 2 mentions only in this talk, but I'll mean core values. You all know what it means. This is something which is very innermost and closest to each and every individual. So these are the aspects of any individual. So if I want to be professional, then I need to look at all these aspects of myself. So that is why I'm calling this a multi-dimensional approach to professionalism. So physical, intellectual, social, spiritual, and emotional aspects, I need to know how to implement professionalism when I practice. Now, let us first look at the physical element of professionalism. And this physical element is also called as the etiquette. Each profession has got an etiquette, which means the way you dress, the way you, move around in the hospital. So this is the etiquette, and this is probably the what is seen by everybody. If I am wearing a jacket and sitting here, just to give you an impression that I'm professional, right? Yeah, actually, I may not be professional, but I want to be a professional, and I want to give the appearance that I'm a professional, and that is the physical element of the etiquette. So the etiquette, all of us are quite familiar. I don't want to waste much time. Nowadays, we have to talk about the mustache and beard, because beard has become a very common accessory for males. So it should be short, clean, and trimmed neatly. And about the hair, for both for males and females. And what about nail polish and earrings and strong perfumes? All this should be avoided. Fingernails should be short. Jewelry, only the wedding band or a wristwatch, not any heavy jewelry, and uniform as per hospital policy. So all these are now taken for granted, and when you join any hospital, you are expected to do, be and the appearance, and that is not the etiquette. But what is we as a professional forget is, and in the physical aspect, is our well-being. So how many of us actually exercise every day to keep ourselves healthy? How many of us watch our weight? You should wear comfortable footwear, because most of us are on our feet the whole day. And it's very important to invest in a good pair of slippers or sandals, and eat a healthy diet and on time. Many of the nurses, I know, when I go on rounds at 2 o'clock, 3 o'clock, they look so famished. And and I asked them, they said, no, I'm so busy, I don't have time for lunch. And that will actually affect the way you work and also affect your professional behavior. And very, very important again to get an adequate sleep. So the physical appearance is one, and being fit to be and act like a professional is also another aspect of the physical element of professionalism. So after physical is social. So I'm actually stripping the individual self in layers. And if you actually meet a professional, you will actually get to know them in this order. Okay, you will first know their appearance, and then you will also know how they interact with others. So it's very easy to find out the social element of professionalism next. So what is that we mean by social element is, as a professional, I'm not going to go into all the aspects. I'm going to touch upon very important things. So each of us can then look at these elements and see what are the things which can be added to this. So I'm going to concentrate on two aspects. One is the team player, and another is your ability to communicate. These two are important for a professional. Now, a team player has got many different aspects. One, you should be reliable, you should be proactive, you should be able to listen to everybody, and finally, you should have respect for your colleagues. So that's all these four are very important to be a team player. So what do we mean by reliable? The first aspect in reliable is punctuality. Now, we all make jokes of IST, Indian Stretchable Time. So when I say, I'll start the webinar at 2:30, I'm getting ready at 2:30 and I'll start at 2:45. No. Now, punctuality is very, very important. And it is one part of being reliable. The next is consistency. Now, I have to be the same, whatever my mood is, whatever my physical tiredness is. I need to be consistent day in and day out. So this is a very important part of being professionalism, and also as a team player, to be reliable. The next aspect is proactive. So usually, we know the meaning for the term reactive. Now, what is proactive? Proactive is taking responsibility for an action. And how do you take responsibility? I want to point out to this particular circle. What we can control is called the circle of control. It may be very small at the time being, depending on how junior or senior you are. And then there may be some region where you can also influence to a certain extent. But the rest of the things, you may talk about it, you may be very concerned about it, but there is, you can't do anything about it. This is known as a circle of concern. So what a proactive person does is, they focus on this circle of control. So what I can control? See, what I can control today in this webinar is how my camera is set, How am I sitting? How is my mic, set up? Am I talking very clearly? These are the things I can control. But if suddenly a current cut happens, or if my server goes down, I have no control over that. But there is no point worrying about it. No, these are called circle of concern. Similarly, in work, each of us have got a circle of control, and if we start working in that, many other people, in your own hospital, will have a lot of influence. They may not have a post, they may not be managing directors or something, but people will respect them and they have a lot of influence. Why is that? Because they have focused on the circle of control. And naturally, when you focus on your control, people start respecting you and your circle of influence will grow. And slowly that lead up also your circle of concern. So this is proactiveness is nothing but, strapping up your boots, tightening your belts, and start doing the things which you can control and start doing it. Don't keep complaining. Don't react to things which you have no concern about. So that's being proactive. The next aspect is to listen. So I wanted to point out that you should be a whole body listener. I had a boss, no medical director who's not who was retired. No, whenever we go to the room to talk to him, he will make a conscious movement. He will move his revolving chair towards us, sit straight, and look into our eyes and just listen to whatever we talk. We may even be complaining bitterly, but he will give his 100%. This is something which I've learned from him. Okay, so your brain should be thinking only about the person who's sitting in front of you. Ears should be hearing, eyes are looking at, mouth quiet, don't interrupt, and shoulder facing the person whom you're listening to. Don't fidget your hands and don't keep drumming the table. Keep it still, and feet also keep it calm and listen. 100% listen. So it's very, very important part of being a professional and being a team player. Finally, respect. Yes, it is respect. You should respect others. At the same time, don't be a doormat. Now people say, what do you mean by that? Don't be so weak and meek so that you allow other person to trample upon you. Very, very important to have self-respect. And when somebody crosses the limit, to tell them, say, very respectfully, saying that they have crossed the limit. So these two aspects of respect are very, very important. So this is part of being the team player. So the next is communication. So we are talking about social aspects. So one I spoke about the team. Another was communication. We are going to have a whole new session, on best practice of communication. So I'm not going to go in detail. So basically use the appropriate method of communication and use the appropriate tools. Very important part of social aspect of professionalism. So the next aspect. So as I said, now I'm going to strip these layers. First, you will see how a person is looking. Next, you will see how the person is interacting with others. The third, you will see also how knowledgeable they are about the profession. It takes a little bit more time to make this assessment. So that is the third layer, the intellectual element of being professional. So here I want to talk about how to become an intellectually professional person is only two things. One is being a lifelong learner and also being open to change. Don't shut yourself saying that I have done my graduation. That's it. I've learned everything. There is so many things which are changing in the world day in and day out, every day. And therefore, you should be open to change. Keep on learning so that you learn new stuff and adapt so that you can give the best to your patient. So that is, these two things. So the lifelong learner is, very important to have a beginner's mind. This is actually a Zen principle. The Buddhist Zen principle, they talk about the beginner's mind. So the curiosity and openness you had as a child about many things dies off as we become adult. We think we know everything. Okay, because of this, we stop learning. So this beginner's mind is very, very important. And this helps us to adapt and also be resilient to change. So change is happening every time. And otherwise, we will become old timers. People will start looking and start avoiding us. Many older people, you would have noticed them. People don't want to go in near them because they just keep talking about their times. So the resilience to change will happen only if you have the beginner's mind and you'll stay relevant. So instead of saying, I know how this works, you should always ask, I wonder how this works. So that's about the intellectual aspect of being professionalism. So you've stripped out the physical, the social, the intellectual. And next comes the emotional aspect. Very, very important of being a professional in our healthcare domain. Emotional aspect is very, very important. It's very gratifying. It has happened to me many times. It happened to me today. So I actually couldn't go to the hospital yesterday because we had a ceremony at home and had a couple of patients, and one patient was just recovering from surgery. So today I went and asked her how she was, and she said, fine. And I said, I'll say, no, I'm going to discharge you tomorrow. Doctor, will you come tomorrow? I said, yeah, definitely I'll come tomorrow. And then she said, when you walk into the room, just your appearance and your, words reassure me so much. I really, feel so happy to see you every day. Now, this is the emotional aspect. I don't think I was born with it. This is something I worked very hard on. To allow that emotional aspect to smile at patients and to make them feel confident that I will do my best is something which you have to work at. So this emotional aspect is very important, and I think empathy is the most important aspect of emotional aspect of being professional. We have now talked about this word a lot of times, but I think we are only talking one part of it. It's like the elephant I told you. Empathy has got several aspects. So what is empathy? So most of us understand empathy as putting ourselves in the patient's shoes, taking the patient's perspective. But that alone is not empathy. You also should take the patient's emotion into it. Are they frightened or are they anxious? It's very important to consider the patient's emotion. And finally, you also have to stop judging them. Don't say that this patient is like that patient is like this. You cannot judge, because you can never imagine you sitting on or lying down on the bed and feeling helpless. So if you do these three things, take the patient's perspective, consider the patient's emotion, and withhold your judgment, then only you are actually practicing empathy. So it's very, very important aspect of the emotional aspect of the patient, of being a professional. Now, the physical, social, intellectual, and emotional aspect has been stripped. And finally, what remains is your core values. As I said, I'm going to tell this term spiritual only a few times here, but I hope you understood what I mean by the term spiritual. So this is the values each of us have, not in our religious aspect or something, the values we bring to work. What are the core values we bring when we come to work every day? So this is very, very important. And there is something which is called the true north. If you take the compass anywhere in the world, it will show the true north. You may think if you're in the middle of the sea, one person may say this is north, other person may say this is north, because we are confused. But the compass will show the true magnetic north. So these values are like that. If you have these values, and these values don't change, what the values were in the 18th century are still core values for our profession even today. So of these, I want to take only two values: integrity and putting the patient first. Now, integrity, what is integrity? Our own Mahatma Gandhi said, when what I think, what I say, and what I do are in harmony, then it is in intellect, it is integrity. So I may say, I want to not take sweets. I think, no, I should not take sweets because I'm a diabetic. That's what I think. And I may tell my doctor and everybody around me saying, no, I'm not going to take sweets. But when you see that gulab jamun, you can't resist it and eat. Then you are not a person of integrity, because these three things are not in harmony. So I hope you understand. This can be extrapolated to work. What you think and what you say, you should show it in action. So that is integrity. And if this integrity is there, Albert Camus has said that integrity has no need of rules. What do you mean by that? See, in our hospital, we have no attendance for doctors. No attendance register, no swiping, nothing. Right from the medical director to the most junior house surgeon, we have no attendance register, because we have created a culture that if you're a doctor, it is your responsibility. You should have the integrity to be available to the patient. So be it the medical director or the senior consultant, junior consultant, senior registrars, up to the house surgeons, they do the job. And if anybody doesn't do, the culture hits them, not the putting absent in the attendance register. That no, the rules will only work to a certain extent. So if you cultivate integrity, then there is no need for rules in your organization. So this is the core aspect. One aspect of the core values. The other is placing the interest of the patient above yours. I always jokingly tell my juniors, don't feel the pulse of the patient, don't feel the pulse of the patient, feel the pulse of the patient. It's a very crude way of telling it. But in this era of commercialization, it is very, very easy to just go along the fine line. If a patient comes to me, with right-sided abdominal pain, it's very easy for me to say it is appendicitis and operate it because I'll get the money. That is feeling the pulse of the patient first. But if I'm really a professional and I have to look at all the aspects of the symptoms and signs and do the investigations, and if it is not appendicitis, I tell him, no, this is not appendicitis, and this is the treatment I'm going to give. I'll see you in another 3-4 days, and then we'll decide. So that is a matter of placing the interest of the patient above us. It's also a matter of integrity. And I think that is why, the core values are very, very important. If you allow money to come in front before the patient, then you know what happens. I don't need to explain that. So that's about the core values. So in short, I have tried to tell you about how as an individual, there are several aspects of us. I tried to point out here, this is the values, physical, emotional, intellectual, and social aspects we can practice professionalism. Now, just for a take-home message, I thought I'll make an acronym called ARISE. So what does ARISE stand for? A stands for altruistic. Altruistic is an English term which stands for being selfless, putting the interest of others before us. So that is being altruistic. So by being altruistic, put the patient first always. And R is respect. Not only you respect others, you make others respect you by having the self-respect. And I is integrity. Align yourself to your true north, the values which it is needed for our profession. And S is service with empathy. And finally, excellence by learning lifelong and being open to change. So this will help you to arise above the others around you, and people will respect you as a professional. So I hope the term arise helps you to remember day in and day out how to practice professionalism in your workplace. Altruistic, respect, integrity, service, and excellence. So many of you said that professionalism is soft skills. I think we should stop calling them soft skills. They are really real skills, and they are learnable. And though it looks a little bit vague, the more you practice them, the more you see others practicing it. It's very, very important to have role models, and you learn from your own experience. You'll make mistakes. Sometimes we may not be acting professional. That's okay. We learn from experience, and then we practice. And in time, we will become professional by integrating all the 5 aspects of our personality to become a professional. So I want to end this talk by thanking all of you for your attention. So this is a Calvin Hobbes, my favorite character. So this is how your curiosity, the beginner's mind should be there. So they see a snake, they're not afraid. So they say, hey, see how it glides along. It's almost like gliding like a liquid, and they run behind it. This curiosity is what is very, very important for us to stay in a professional all our lives. So thank you so much.